Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. I selected like 4 tools that you can use for the back pain. Those comes as a kit, and you can use it for treating your back. So the first one is the A5. This is the one that has wings and pointy rubber. So when you use this, it's very simple. With the other hand, you're gonna palpate the area in the back or the glute area, and when you feel there is a nod, that's the area you're gonna put the rubber on. And when you do it like 1,000, 2,000, 3,000, really slow pulse in, as deep as much as possible, as long as it's not painful. There's a couple of ways to hold the A5 tool. One is like this, and you push down this way, or with your forearm you push down. That's why I designed these wings, so you use less energy to push down. With sciatica, you can do that. For back pain, stenosis, you're gonna use it on the entire area here. If you're gonna use it around the ribs, be very careful. You can crack the ribs if you push down this way. So I usually be very gentle when I work on the paraspinous muscles, so you don't fracture any ribs. Okay, so that's the A5. I usually start dry, so that's why we're gonna go the A5 and then the A1. This is the one. So the A5 is to release the deep fascia and release the deep nod scar tissue. The A1, we're gonna use it to release the superficial fascia. So you release the entire back, mid back the same way. So that's the A1. You should use the A3 afterward, but I'm gonna use it at the end because we have to clean for the lotion. With the kits, we included the Magnaheal. This is what I usually use, especially for sciatica and spinal stenosis or any inflammation in the back. The best way to use it for a very long time. If you have someone to help you to do the maneuvers, like going over the spine back and forth like this, it's more effective. If you don't have time, someone to do that, what I usually recommend for patient, and you have patient walk with it, you put it in like the underwear or the clothes and walk with it. For spinal stenosis, I have them walk with it actually. And if sciatica and you feel it here, you put it inside and just walk on it with it. Do not sit on it. The more inflammation, the more time you need to use it. For the Magnaheal, and I have a full video on the Magnaheal. Make sure you watch that video. But for the back, you can do it this way. Okay, that's a Magnaheal. For the A3, this is a tool we use it to break the scar tissue. So A3 is a big tool with the handle. You're just gonna hold it like a hammer, very simple. I have several curvature here. Those to match the body part. So if it's a bigger body part, you can use a bigger curvature. Smaller body part, you use a smaller curvature. You use lotion with this, and you wanna make sure you do the glutes, the hamstring that attach from here to here, the IT band, both sides. So you're gonna do clean the whole area with this tool. And with the A5, you look for a nod. You feel a nod here. With the A5, feel a nod here. You do the nod. So release the entire area here, the whole back here, and we'll show you how to do the front. It's very common with back pain patient that they have a stomach tightness. Think about this way. If you have like a patient, someone has a C-section, any surgery in the stomach area, they usually have a scar tissue in the front. And when that scar tissue, it usually does this, it pulls down. So it does not matter how much work you do in the back. If the scar tissue, the tightness in the front, and your pain in the back as compensation for the front, you have to do the front. Especially if you have any surgery, and when you touch the surgical side, you will feel a lot of scar tissue. In a lot of time, you actually can do the front for yourself using the A3 on the C-section or any surgery that occur in the front. Just break it up and do the hips on the top. Sorry, I got it in the close. And on the other side. And a lot of the time I can do the quad 2 in the front here. So, which tools I use on the front? I usually do the A3 and I use the A5. But when you use the A5, you gotta be very careful. So what I really is, you don't push on the reps around here or here. You see the bones. You will crack it if you do that. You don't want to do that. So in this video, I will show you some core exercises. Before we start, the most important exercise for the back and for posture in general, to correct your posture, you have to suck your belly button in all the time. Before you do any exercises, you have to start with a good posture, good position. So suck your belly button in all the time, straight pulling your head up. And that's with the sitting posture, the standing posture, and also with any exercises. So the first thing we're going to do, we're going to lie in our back. And I will start with the emergency exercises, the one that I showed you, I was talking about in the PowerPoint to fix the pelvis. So there's a couple of versions of doing it. First one is you lie on your back and squeeze your buttock really tight, 5 seconds, and there you go. Squeeze it very tight, 5 seconds, there you go. I will do 2 to 3 times. You do that when you feel your pelvis out of alignment. How do you know if your pelvis is out of alignment? Couple of things. You feel when you walk, you feel like there's one leg longer than the other leg. The other thing is, when you do this test, lying on your back and sit up, some patient can do it, other patient cannot do it. If you feel pain doing this exercise, I will avoid it. But when you sit up and you look at your knees, you will notice one knee higher than the other knee. So that's an indication the pelvis out of alignment, and you need to correct it. How many times you're going to do that a day? It depends on how often your pelvis gets out of alignment. So if you usually in the beginning, when you start to work on a soft tissue with the tools, you will have your pelvis will get out of alignment more frequent. But with time, this will happen less frequent. So you might start to do it 10 times a day, then 5 times, 2 times, and you don't have to do it. So this is the most effective way to get your pelvis back to normal alignment. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.